Welcome to This Week in Psychiatry. This week we're covering 9 notable papers spanning pediatric and adolescent interventions, neurodevelopmental outcomes across the lifespan, and critical strategies for optimizing psychopharmacology and prescribing safety. Let's dive in. We begin with a cluster of studies focusing on early intervention and development in children and adolescents. First, in a large-scale prospective study, researchers investigated whether breastfeeding duration might protect against the development of attention deficit/hyperactivity disorder, or ADHD, symptoms. Analyzing data from over 37,000 children in the Norwegian mother, father, and child cohort study, the authors found that each additional month of full breastfeeding was significantly associated with a small but steady decrease in parent-rated ADHD symptoms at ages 3, 5, and 8. Crucially, the researchers accounted for parental polygenic risk scores for ADHD, and their findings remained robust in sibling analyses designed to control for unmeasured familial confounding. This suggests that encouraging full breastfeeding, even for short periods, may have a small, cumulative protective effect on neurodevelopmental trajectories. Moving from early developmental factors to active therapeutic interventions in neurodevelopmental conditions, a randomized clinical trial, also published in Biological Psychiatry, evaluated the use of 40 Hz high-definition transcranial alternating current stimulation, or TACS, targeting the right temporoparietal junction in 47 children with autism spectrum disorder. The right temporoparietal junction is a key hub for social cognition, and gamma band abnormalities are frequently implicated in autism. The researchers found that children receiving 21 sessions of active stimulation over 7 days demonstrated significant, rapid improvements in social functioning at both 1 week and 4 weeks post-intervention, as measured by the Ohio State University Autism Rating Scale DSM-5. The intervention was well tolerated with no serious adverse events, and eye-tracking metrics during social cognitive tasks supported these behavioral improvements, although the authors note that further evaluation is required to establish long-term clinical significance. In the domain of adolescent internalizing symptoms, a systematic review and meta-analysis in the Journal of Child Psychology and Psychiatry evaluated the efficacy of self-administered single-session interventions, or SSIs, for youth mental health. Synthesizing data from 25 randomized controlled trials involving over 5,000 young people, the authors found that these brief, self-guided tools yielded a small but statistically significant reduction in both anxiety and depressive symptoms. Given the substantial barriers to accessing traditional, face-to-face adolescent mental health care, these self-administered options represent a highly scalable, low-barrier first-step intervention, though clinicians should note the high heterogeneity and wide prediction intervals in the data. Finally, addressing adolescent eating disorders, a randomized controlled trial in the Journal of Child Psychology and Psychiatry compared traditional family-based treatment with a novel 6-session brief interoceptive exposure intervention targeting visceral sensitivity and autonomous eating in 60 adolescents with low-weight eating disorders. The researchers found that adolescents randomized to the interoceptive exposure protocol consumed roughly twice as much energy during post-treatment single-item and multi-item laboratory test meals compared to those receiving traditional family-based treatment, without any significant differences in weight gain between the groups. This suggests that integrating interoceptive exposure, which systematically targets the somatic anxiety associated with eating, may rapidly improve functional eating behavior in this highly challenging patient population. Next, we look at a vital epidemiological study. Using Swedish registry data spanning nearly 3 million individuals, including over 70,000 autistic people followed from age 16 up to 46, researchers investigated the relationship between co-occurring psychiatric conditions and premature mortality. The findings were stark. The mortality rate among autistic individuals with co-occurring psychiatric conditions was over 3 deaths per 1,000 person-years, compared to less than 1 death per 1,000 person-years in autistic individuals without a psychiatric diagnosis, and less than 1/3 of a death per 1,000 person-years in the non-autistic population. After adjustment, autistic individuals with psychiatric comorbidities faced a nearly 14-fold increased hazard of premature mortality compared to non-autistic individuals without psychiatric conditions, and a more than 3-fold increased hazard compared to autistic individuals without psychiatric conditions. This elevated risk remained consistent across sexes, intellectual disability status, and co-occurring ADHD. For practicing clinicians, this study is a powerful call to action, emphasizing that the elevated mortality in autism is heavily driven by treatable psychiatric comorbidities. Timely, aggressive identification and treatment of depression, anxiety, and other psychiatric disorders in our autistic patients is not just a matter of improving quality of life, but a direct, life-saving intervention. Our final theme explores neurobiology, translational drug development, and safe prescribing practices. In biological psychiatry, a review paper reevaluates why clinical trials of novel, non-dopaminergic antipsychotics often fail, proposing a major paradigm shift. Preclinical models demonstrate that hippocampal hyperactivity and a loss of parvalbumin GABAergic inhibition drive downstream dopamine system dysregulation in schizophrenia. While traditional D2 receptor antagonists normalize this dopamine hyperactivity via depolarization block, they leave the upstream hippocampal dysfunction untouched. Newer compounds, such as GABA alpha 5 positive allosteric modulators and evenamide, target this upstream pathology directly, offering hope for treating cognitive and negative symptoms without D2-related side effects. However, the authors argued that clinical trials of these promising agents, like pomaglometad, frequently fail because participants have had prior exposure to traditional D2 antagonists. This exposure induces postsynaptic dopamine supersensitivity, meaning that when patients are switched to a non-D2 targeting drug, they experience a relapse driven by this supersensitivity rather than a lack of efficacy of the new compound. Future clinical trials must account for patients' treatment histories to successfully bring these side effect-sparing treatments to market. Also in biological psychiatry, a comprehensive review highlights the emerging role of glucagon-like peptide 1 or GLP-1 receptor signaling in learning and memory, pointing to a novel therapeutic avenue for cognitive decline. Preclinical studies show that GLP-1 analogs improve memory deficits and enhance hippocampal neuronal signaling in models of dementia and metabolic disruption. While human trials show mixed results, often due to being underpowered or lacking comprehensive cognitive testing, the authors recommend that future clinical trials of GLP-1 analogs for Alzheimer's and other memory disorders should specifically target and stratify metabolically vulnerable individuals, as metabolic and inflammatory pathways represent primary mechanisms of action. Turning to clinical safety and prescribing patterns, a massive population-based retrospective cohort study of over 1.8 million adults in PLOS medicine provides actionable guidance on preventing long-term benzodiazepine dependency. The researchers analyzed the association between initial prescribing characteristics and the time to benzodiazepine discontinuation. They found that initial prescriptions lasting longer than 7 days were strongly associated with a lower likelihood of discontinuation. Specifically, an initial prescription of 8 to 14 days roughly halved the likelihood of discontinuation, while a prescription of more than 30 days reduced the likelihood of discontinuation by 86%. Furthermore, initiating treatment with long-acting agents, a combination of short and long-acting agents, or multiple concurrent benzodiazepines also significantly reduce the likelihood of successful discontinuation. Clinicians should therefore restrict initial benzodiazepine prescriptions to a single short-acting agent for 7 days or fewer to minimize the risk of long-term dependency. Lastly, a commentary in the British Journal of Psychiatry injects a dose of basic chemistry into the growing interest surrounding lithium orotate for neuroprotection. Responding to claims that lithium orotate is superior to traditional lithium carbonate, the authors point out that there is no evidence that stable lithium orotate complexes exist in physiological fluids. Instead, gastric acid-based chemistry dictates that lithium orotate will rapidly dissociate in the stomach, meaning it is absorbed simply as free lithium ions, with comparable pharmacokinetics to lithium carbonate. The authors caution against a disproportionate clinical focus on specific alternative salts. emphasizing that we should instead focus on understanding the neuroprotective effects of very low doses of standard lithium, which have already been demonstrated in historical literature. If you only have time for one paper this week, make it the massive Swedish cohort study on autism and mortality. This study provides definitive, population-level evidence that the tragic excess mortality seen in autistic individuals is largely driven by co-occurring, treatable psychiatric conditions, offering a clear and urgent target for clinical intervention in our daily practice. Here are the key takeaways from This Week in Psychiatry. First, when initiating benzodiazepines, limit the first prescription to a single, short-acting agent for 7 days or fewer to significantly increase the likelihood of successful discontinuation and avoid long-term dependency. Second, actively screen for and aggressively treat co-occurring psychiatric conditions in your autistic patients, as these comorbidities are major, preventable drivers of premature mortality. Third, consider incorporating brief interoceptive exposure techniques into the family-based treatment of adolescents with low-weight eating disorders to more rapidly target food avoidance and somatic anxiety. Fourth, encourage breastfeeding when discussing early infant development, as each month of full breastfeeding is associated with a small, cumulative reduction in childhood ADHD symptoms. And finally, keep an eye on upcoming trials of novel antipsychotics, remembering that prior D2 antagonist exposure can mask the efficacy of newer non-dopaminergic agents due to postsynaptic dopamine supersensitivity. That's your roundup for This Week in Psychiatry. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.